And the way he describes it is that our natural teeth are the best things that we could ever have. They're given us to us from God. And for whatever reason, we lose them. They've had to come out. They've broken. They've had gum disease around them. Like whatever the reason is, implants can suffer the same type of things. You can have bone loss around a tooth. You can have bone loss around an implant. You can have infection around a tooth, and you can get an infection around an implant. I've had patients where I've placed a set of implants and their body rejected them. And so then I went in with no additional charge, replaced those implants, and most of those came out. So there's a lot of pain and suffering for patients when things don't go right, but a lot of pain and suffering for the dentist, the person who's expected to be perfect and to do these things. We can have a whole nother podcast on how dentists carry the weight of the treatment they do and if it's successful or not, or how the patient feels about it. It could be my best work, but the patient doesn't like it. There's this weird turmoil and conflict that as dentists we carry. But it's a lot of struggle to learn how to place implants and to help people like Darlene. And so a lot of dentists don't take that on. Why have the headache? Why lose the sleep? Why get the gray hair? So, but for me, it wasn't about implants. Yes, I have a passion for implants, but it's because I know what implants can do for patients. Because what started to happen is I would have people come find me online through my marketing, and they would come into my chair and they would share some of the most heartbreaking stories I've ever heard. I think the most saddest ones are a husband or a wife who lost their spouse and has gone through the grieving process and now is ready to find companionship again, but they're embarrassed to start meeting people.